So you're getting your veneers done and you would like to know what's the best color for you. So in this video, we're gonna go over 5 things you should consider before selecting your color. So first one to consider is how many teeth are you doing? If you're doing just limited amount of teeth, if you're doing just 4 or 6, then we definitely want to consider a color that's much more natural. We want to blend your veneers with your existing teeth so everything looks pretty real. You don't want to have 4 teeth or just 2 teeth that are really bright than the rest of your smile, because that doesn't go. If you're considering just the top teeth, you definitely want to consider whitening your bottoms and get them to a closer match as much as we can. So second thing to consider is your skin tone and your hair color. I think a lot of times we see patients where they want to go with the color of somebody else, like they've seen some photos of some other patients and they really like that color, but they don't understand that they are low different skin tone. If their hair is much lighter and if their skin is much lighter also, they can go really bright and it can still look very natural. But if you have a darker skin tone, darker hair, that same color may look just a little too much. So we definitely want to consider the right color for each patient based on the skin tone. Third thing to consider is the size of your teeth and your veneers. If you already have veneers or your teeth really big and you go with the brighter color, it's gonna give you bigger volume. It's gonna make your overall smile look bigger. So at times we wanna neutralize things and make things appear smaller than it is, kind of like contouring. Then we may want to go with the color that's not the whitest, maybe the little more warmer, a little more subtle, where it looks a little smaller. If you have small teeth and you want that bigger look, then just going brighter is gonna give you that. The whiter it is, the bigger it looks. So definitely keep that in mind. A lot of time patient wants this really white smile, but they don't understand that it's gonna also make your smile look bigger. And if that's something you don't want, definitely go with the color that's a little more natural looking, maybe not the whitest. Fourth thing to consider is your personality and your aesthetic goals. I have patients that are in entertainment industry. They want that beautiful glitzy glamour look, and for those specific patients, we definitely want to go more on the brighter side. Then we have patients that are either doctors, nurses, and they just want a very natural smile. They are not looking for that artificial fake look. They want just something that looks like real teeth. And for those patients that we may consider a little more warmer, a little more natural looking when it comes to color. Fifth thing to consider is just giving it a try with your temporaries. A lot of patients that wanted a natural smile and gave them a little brighter color because they just let me decide for them, and some of them just like the whiteness of their temporaries. So I think leaving that door open and letting your doctor really help you figure out what color might be the best suitable for you, because you don't really know what is gonna look good on you. So getting a good temporaries, I make all my temporaries myself. I wanna make sure that my patients get to see exactly what they may wanna have as a permanent smile. So I get them a color that may be a little more better fit for them, and then we decide whether we want to go with that color, a little whiter, a little less. So just fifth most important thing is to leaving it open, letting the doctor help you decide on what might be the best color for you. If you have any questions, if you're in the process of getting your veneers done or you're thinking about veneers, we're here. Send me some photos. We'd love to connect. We do a lot of video consultations now, and most of our patients are traveling patients. So if you're not in LA, we can still get this done, maybe 1 or 2 appointments. So let's get connected.